Welcome back to Bariatric Business Accelerator, the podcast created for busy weight loss practitioners and their teams who want to systematize, simplify, and accelerate the growth of their new or existing weight loss practice. I'm your host, Carol Clark, and I am here with part 2 of some of the themes that I see when I go in and do site visit analyses or evaluations, whether it is on site, which is always nice, or whether it is remote, which we can make work as well. But today I wanted to share with you some of the outcomes or the most common interventions or prescriptive plans that we end up working on after the assessment is done. And you can do this internally, do your own assessment and implement some of the things I'm going to mention. Or of course, you can always reach out to me if you wanted any assistance with that in any way. You can even just join membership, which is an easy way to get to work together too. At any rate, what ends up happening is if you look at review the first one, which is the 5 common themes that I see, which relate to your team, your metrics, your finances, all that sort of thing. I went through 5 of them. Here is how we tend to make a difference and pretty quickly make a difference. So the first one really is typically a process flow enhancement initiative. And for that, we take a look at your entire flow for your practice, how you're implementing your patient care. Also, we involve the health system. If it's a health system based program, we really look at what is that whole flow looking like, where are there bottlenecks, and we start early on in your marketing efforts, and then we get into really how the patient, the lead is captured, how they're nurtured, how they're converted to a consult, how they're converted to surgery or paid services, how it goes all the way through from a patient referral perspective. So we go through this entire process. We do it for patient care. We can also do the same thing if there are issues with your team. Sometimes I do this in terms of a process flow for what your organizational chart looks like, how you're hiring people, where you're finding them, how you're onboarding them, how you're training them, what the roles and responsibilities are there job descriptions in place, are there metrics that are measured, KPIs for each position. We do this in a process flow procedural method as well. So we do it for both of those. And that is something that really opens eyes and helps to streamline things for you so that you have more predictability in every aspect of your practice, from patient care to profitability to just having some more peace of mind knowing that there's systems in place. So that's the first one, is really process flow enhancements, depending on what area you want to focus on. The other thing commonly done is perhaps a competitive analysis in your area to ensure and do an evaluation of what's going on with your primary competitors in your area. This can glean a lot of information from a marketing perspective, just from a volume perspective, and kind of just give you a little litmus test in terms of how you are compared with your competitors. So we don't like to get comparitis or anything, but sometimes it's helpful, or oftentimes it's helpful just to have that knowledge, so we can do a competitive assessment. The other thing is a marketing plan development. So this is typically done with your marketing department, your webmaster, depending on the size of your program or your practice. And we put together things that you can do right in your practice that are low or no cost ways in terms of content marketing. We look at all your initiatives, what your website, everything like that. And we do sort of a marketing plan development so that you are better equipped moving forward and spending money on things that are going to be effective. We can test them out and do the effectiveness before you invest more money, or maybe put together an entirely organic marketing plan that doesn't involve a large outlay in terms of advertising. So we can do that in a variety of ways, but we do assess your website. We take a look at all the different ways that you're lead capturing, how you're tracking your patients, the whole marketing aspect of that. So that's another area that we do. That's the third one. The fourth one is oftentimes there are surgical programs that want to add in medical weight loss or some of the injectable medications. We talk about different ways to do that, how to implement that, retail sales, all of that. Or actually, you may or may not be surprised to find that there are a number of practitioners who want to go out on their own from primary care and do their own program for medical weight loss. And so I get to help either build them from the ground up, or somebody who's just getting started will reach out and we will deep dive into all all the things that need to be in place for a profitable and a productive medical weight loss practice. So medical weight loss is one of those things that is being implemented, obviously, as a comprehensive program in conjunction with metabolic and bariatric surgery, as well as independent practitioners. So for medical weight loss. So that's probably the fourth way that I work mostly with people. The fifth one is a financial analysis. Oftentimes things may or may not be tracked in terms of financial analysis. We take a look at how you're billing, what your package pricing is, if you do cash pay, are there other areas that you are overlooking, what's the average reimbursement for different payers that you have, what is your payer mix. We look at all of that and then make some determinations, some metrics moving forward, so you have a great report card that you can track. And we put all that into place, looking at the previous year and then setting those systems into place for moving forward. So these are a number of the common initiatives that you can do in your own practice, or I oftentimes will help with this, but these are the ways that you can tackle some of those common themes that I mentioned in the last podcast. So I hope you found this helpful. And if I can help in any other way, reach out to me, Carol, K-A-R-O-L, at weightlosspracticebuilder.com. Or you can just sign up for my newsletter and get lots of free information, or go to the free resources on my website. So at any rate, weightlosspracticebuilder.com has it all, and you can always reach out to me personally. I am, like I say, honored and blessed to get to work with lots of different practices. I have an awesome team that helps with many of the different initiatives that we're working on with practices. And if I can help in any other way, reach out to me. In the meantime, take care.